Friday to you, and welcome back to the Friday 5 here on the Agent Survival Guide podcast. I'm your host, Sarah Ruppel, and each week we look at 5 things insurance agents should know about, either broadly or, in this week's case, with a focus on one topic. This week, that topic is ICHRA. First, let's start with a working definition of ICHRA. It's a type of HRA, or Health Reimbursement Arrangement. ICHRA stands for Individual Coverage Health Reimbursement Arrangement. It's an alternative to traditional group health coverage that gives both employers and employees more flexibility in their choices. You might have also heard them referred to as a defined contribution health plan. For the purposes of our episode, we will stick with calling them ICHRAs. Like traditional coverage, employers fund a portion of the ICHRA, and it's a tax-free benefit for employees. The employer sets a contribution limit for every employee. Then, the employee shops for coverage on the individual health insurance marketplace. They can choose to enroll in their choice of on-market plan, as opposed to having little to no choice with a traditional group plan. Another distinguishing feature, the employer contribution amount is a set dollar amount rather than a percentage of the premium. This gives the employer more control over their annual health benefit budget. Employers can choose to provide coverage for up to 11 employee classes, delegating coverage amounts for each class. Not only does this allow employers to control costs more efficiently, it also gives them the ability to provide contributions for part-time, short-term, and even temporary employees at different levels than full-time workers. There are 11 officially defined ICHRA classes. However, employers do not have to provide coverage to every class. That's another way the ICHRA is not like traditional group health coverage. In addition to choosing which classes to provide coverage for, there are also no participation requirements. Another important note, employers can choose to offer an ICHRA for other types of coverage, like dental, vision, and hearing coverage, as well as other non-health related products like life insurance. Employees are reimbursed for plan premiums by their employer through the ICHRA. This happens similarly to how traditional group health insurance deductions are made, through the employee's paycheck. Some ICHRAs include coverage of qualified medical expenses, or QMEs, as we like to abbreviate them. When an employee has a QME, they file a claim through a third-party administrator who then determines if the claim is eligible. Then, the administrator takes care of reimbursement, alleviating the employer from that particular administrative oversight. Next on our list, we've mentioned some in passing, but let's get into the benefits of ICHRA. On the employee side, we talked about how an ICHRA allows for more plan choices than traditional group insurance. It also allows for plan flexibility and portability. When an employee leaves the company, they can choose to stay enrolled in their coverage rather than losing it completely. They'll stop receiving the reimbursement amount, and they will have to pay the full cost of coverage themselves, but they can choose to take their coverage with them when they go. On the employer side, there are a few more benefits to mention. We covered better budgeting, but there are other monetary benefits worth talking about. An ICHRA can be more affordable for an employer to offer than traditional group health insurance. Reimbursements are tax-free with no annual caps. On the subject of risk, the ICHRA actually transfers employer responsibility for health risks to the employee. By creating an ICHRA, a business legally satisfies the ACA employer mandate. When created, an ICHRA triggers a special enrollment period, meaning that a business can start to offer one at any time. Employers can offer more personalized plan choices for their employees, as well as having simpler and more flexible plan design options. We mentioned no participation requirements on an ICHRA, which translates to no participation concerns for employers. The ICHRA is an employee benefit that functions well as a recruitment and retention tool, too. And then another positive in the employer bucket, less administrative work, which who doesn't love that? Number 3. You might be wondering why all this sudden talk about ICHRA. Maybe it's the first time you've heard of this type of health reimbursement arrangement. There are a couple factors contributing to the popularity of the ICHRA and other HRAs. First and foremost, the cost of insurance coverage continues to rise. In 2024, companies were budgeting an average of almost $15,000 per employee. For 2025, the average increased to over $16,000 per employee. Rising costs are being driven both by inflation and costly GLP-1 drugs used for diabetes and weight loss. That can push the cost of providing traditional group health coverage out of reach for some employers. Adoption of ICHRA plans continues to grow. According to the HRA Council, from 2023 to 2024, ICHRA adoption increased by 29%. From 2024 to 2025, adoption grew by 34% for all applicable large employers, or ALEs, which includes employers with more than 50 employees. Large employers aren't the only ones taking advantage of this alternative to traditional group coverage, though. Small employer adoption increased by 18% from 2024 to 2025. Moving on to number 4, how do agents and brokers fit into the ICHRA mix? There are 2 different scenarios here, both of which start with an agent or broker working with an employer group who is interested in setting up an ICHRA. They'll work with a third-party administrator to collect the appropriate data to determine which classes of coverage to offer, set a contribution strategy, and then help enroll employees into coverage. Depending on the third-party administrator or TPA, the agent can facilitate enrollments and retain their agent of record status on the policy, or the TPA handles more of the administrative work and pays the agent a referral fee. Last but not least, at number 5, some third-party administrator options we partner with here at Ritter Insurance Marketing, the FMO that powers this podcast. Here at Ritter, we are not directly training, supporting, or facilitating ICHRA enrollments, but we have partners who do, and we are excited to bring this opportunity to agents. We're proud to have established partnerships with 2 TPA administrators for agents interested in offering ICHRAs. NextBen and Easy ICHRA can both help you support employers interested in presenting ICHRA to their employees. Each partner has different opportunities available with varying engagement levels. For agents and brokers who want to offer this option to employers but want a little more hands-off approach to handling ICHRA facilitation, Easy ICHRA is one TPA we've partnered with. The partnership is referral only, meaning that agents can refer employers for payment, but they are hands-off once the ICHRA has been established. If you're an agent who wants to offer the ICHRA option and stay on as the agent of record, we've also partnered with NextBen. With NextBen, agents can assist employers with ICHRA administration and payment processing. There's a referral option for agents who'd like to be more hands-off, and then there's also an option for an agent or broker to maintain that agent of record status. To learn more about the Individual Coverage Health Reimbursement Arrangement, or ICHRA for short, make sure you visit our episode notes. We will be linking to a helpful blog post detailing how an ICHRA partnership can support ACA sales, as well as other resources so you can learn more. We will be linking to a variety of resources so you can learn more. And if you have questions about ICHRA, or maybe its cousin, QSARA, the Qualified Small Employer HRA, let us know. We'd be happy to answer those questions and put an episode together about that type of HRA. You can email your questions into the show at asgpodcast@ritterim.com. That's all we've got for this episode. I hope you have a great weekend. Stay healthy and stay safe out there, and we will see you next week. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written and produced by me, Sarah Ruppel. Script editing and fact check by Tina Lamoureux. Podcast design by Urban Rivera. Follow along with our show wherever you like to listen.